everybody. Welcome to COVID Café number 4. Today we will focus on the effects on the global COVID crisis for local humanitarian leadership. What are the consequences for COVID for the position of decision-making power of local NGOs? That is the subject of today, and I think we have really a beautiful panel. We have speakers from all around the world, from Iraq, from South Sudan, from Venezuela, and more. And I will introduce them to you properly in a minute. Thank you for joining us today. I see we have now 30 people participating. I think the number will grow. We had like 70 people who joined us, who registered earlier today. So maybe you can join us not only by listening or looking at us, but also by sharing your thoughts and your questions. You could do it via the chat box or via the Q&A box below in your screen. And some people already mentioned who they are and what they are doing. Please share your names and your organizations if you wish via the chat box. That's nice to know for us as well. My name is Peter Heinze. I'm the coordinator of KUNO, the platform for humanitarian knowledge exchange. This idea all started in a discussion with Oxfam. So today I have a new co-host also from Oxfam. She is Anita Katakusi, Oxfam International she works for. And Anita is humanitarian policy advisor on localization. Oxfam International indeed, and currently based in Amman. I'll start with you and then I go to the other panelists. Anita, I don't think there are many international NGOs who have one person or several persons working solely on localization. And I believe Oxfam has several. Why is it necessary?
Hi, good morning, good afternoon, good evening. Thanks everyone for joining. Yes, my name is Anita. Why is it necessary for an international organization like Oxfam to resource or staff localization posts? Because the international community, INGOs, have a responsibility to make changes and advocate for to further progress and to meet localization ambition. So localization isn't an agenda or a process that can be exclusively done and led by local and national organizations. Actually, the whole sector has responsibilities and actions that are needed to take forward. And so Oxfam, in order to make these changes, has staffed people like myself and others to try and help our organization meet our commitments.
Okay, thank you. And what is your role exactly? What is what you do on a day-to-day basis?
On a day-to-day basis, I do a lot of writing and reading. No, I am in an advocacy role, and I help Oxfam develop our key messages and priorities and actions for influencing the sector, stakeholders, power and decision makers in the international community, the donors, but also what our position is for various localization issues.
Thank you, Anita. Anita will be co-hosting, so she will be in and out every now and then, and she will, together with me, check the chat box, and she has been a wonderful help in organizing these speakers we have from all over the world. Thank you, Anita. I'll introduce the other speakers now. We have from Iraq, Hero Anwar. She is Program Director of REACH. From the South Sudan, we have Gloria Medong, Executive Director of the Titi Foundation and Deputy Chair of the NGO Forum. And from Venezuela, we have Feliciano Reina Gontome. I hope I do this right. Executive Director of Acción Solidaria and representative of Syphilis. And I'm very glad we have you all from all those kinds of the world. But we have one special guest for just breaking open our minds. And I think I would like to start with her, if it's okay with the local leaders we have. I'm very pleased we have another guest. And she's from the Netherlands, just like me, and she's constantly advocating for these kinds of events. Please, people, talk together. Talk about what are we doing? Are we doing the right things? Are we doing them in the right way? She's always pushing for debates, informal discussions with humanitarian professionals, whether it are practitioners or whether it are policymakers or academics. And when she heard about the COVID Café, the first reaction was, oh, how good you're doing this, how nice. She's Professor of Humanitarian Aid at the International Institute of Social Studies of the Erasmus University here in the Netherlands. Thea Hilhorst, you're with us, aren't you, Thea? You have to unmute yourself, I think, Thea.
I'm doing it. Yeah.
Ah, good to have you here. And you offered to open up our minds, to stir us up a little bit. So are you ready
What
for
I
it,
call, I'm doing the mental floss.
Yes.
Not the dental floss, but this is my mental floss for you.
Okay.
I hope it's not too long, because when I started, I really got, into it. And I noticed there's so many things I wanted to say. So stop me, Peter, if it's too much.
We say stop if it's too much.
Yeah.
But I'm just, okay, thank you, Thea. Go.
And sorry if I look down a bit, because I'm actually reading my live blog from my other screen. COVID-19 is sweeping the globe and widely triggers top-down and centralized emergency measures. I don't recall any other crisis that created such a response, even though the actual numbers of people affected have been very modest compared to many of the other crises we have in this world, including lack of access to clean water, resource competition in mining areas, conflict and refugee problems, and climate change. So in the beginning, I often found myself thinking if only the world would muster the courage to also address these other crises and give them more priority than short-term economic gain. However, it's also clear that there are strong limitations to the bold and robust responses of top-down emergency management. Firstly, I really resent how we seem to conflate the hazard of COVID-19 with subsequent risks. Yes, COVID-19 is a nasty and infectious virus, but it is not a virus that dictates that it should lead to widespread food shortages or increased marginalization of the poor and vulnerable populations. These are spillover crises that relate to, but they're not directly caused by this virus. So the spillover crises are not just happening, they are let be by policy. When we signal the risk of food insecurity in the wake of COVID-19, I see agencies jumping to raising funds and stockpiling to feed the world. However, why don't we talk about preventing this crisis? Why not focus on diplomacy to continue food export from service-producing countries? Why not ensure that markets stay open and continue to function? Why not give peasants free range to go to their fields instead of locking them down in their houses? Secondly, we have to be really vigilant to protest the many instances where governments have instrumentalized COVID-19 for other purposes, to curb civil society, silence the media, or undermine political opponents. Hungary, here in Europe, is a case in point, where the government, under the pretext of misinformation about COVID-19, closes critical media outlets. Authorities in many areas are seen to instrumentalize COVID-19 to increase surveillance and control at the detriment of human rights and civil society, with rumors increasing the mistrust between people and the state. Thirdly, while there is no doubt that top-down policies and expert knowledge is required to curb the crisis of COVID-19, there are also indications about the limitations of this approach. Top-down approaches may ignore, stifle, or expire local coping capacities, social networks, and small-scale formal and informal institutions. Based on previous experience and research, this may have grave consequences and turn the COVID-19 response completely counterproductive. 3 reasons. 1. Local institutions are people's first and very often only line of defense against the crisis. So when top-down policies don't reach out to communities to provide services and people cannot rely on local institutions, they become increasingly vulnerable. Why close schools instead of mobilizing teachers to help in spreading messages about personal hygiene in relation to COVID-19, for example? 2. In areas where state-society relations are already characterized by mistrust before the crisis, there's a high risk that people will not believe the messages about COVID-19 coming from the authorities and try to circumvent policies aiming to prevent its spread. A notorious example was found in Ebola in Sierra Leone, where people sometimes hid patients in their houses to avoid they were taken to the hospital because they didn't trust the government. Third, one-sided top-down policies can contribute to spillover crises at the local level, including crises of livelihood and food security, And this can lead to adverse coping mechanisms that actually increase the risk of COVID-19. There are signals, for example, that some women in Eastern DRC who are prohibited to cross the border with Rwanda for their petty trade now resort to transactional sex to feed their families, which is of course much more dangerous because you cannot do that with social distancing. Okay, let's stay alert, or as we say nowadays, be woke on the consequences of responding to COVID-19. COVID-19 is a hazard, but it doesn't make the risks that we now see unfolding throughout the world. Top-down measures need to be linked up with bottom-up initiatives and coping mechanisms to effectively deal with the crisis. Thank you.
Thank you, Thea. Thank you so much. So, in my words, top-down might be is necessary, okay, but please do not forget bottom-up is just as needed as well. So let's go to the local leaders we have here. We make a tour de horizon around the world. Thank you, Thea. I just decided to go from east to west. We could also go from west to east, but I think let's start in the east. So we start with Iraq, then we go to South Sudan, and we end in Venezuela. I would love to hear from these three local leaders how they cope, what they are doing, but also how COVID is changing their position. Is it going to the better way or to the worse way? And maybe they have the same stories, but maybe also very different stories. So I'm really very curious about what you have to tell us. And we start with Hero. Hero is from Iraq. She's now on black because the lines were not very strong. She might try to turn her video on. Hero Anwar, Program Director of REACH. Can you take over here, Hero?
Thank you. I will turn the other internet for the video. So if the first person speak until I change that to be the second one and the video I change the connection.
Perfect, Hero. Then we go first to Gloria Madong. She's Executive Director of the TT Foundation and Deputy Chair of the NGO Forum in South Sudan. I think Gloria did also switch her video off because of the same reason. I'm very glad we have you. So Gloria, please, can you take the floor as first?
Thank you, Peter. I hope I'm very clear. Good afternoon, good morning, and good evening, everyone. Mine is just on the shift of power and the consequences of COVID-19 and how that is affecting local actors in South Sudan. Well, there's both a positive end to it and a negative side to the pandemic, to the local actors. One of the negative aspects to local actors about the pandemic is that, one, the local partners are being weakened in terms of decision making, and this is sometimes due to the technological barriers that are available. In the setting of South Sudan, we find out that local actors do not have advanced technologies within their offices and even in their work compared to our international counterparts. And thus, with the fast spread of the pandemic around the globe, we were hit before being prepared. So in that regard, basically, a lot of the people that are taking lead in terms of how contingency plans on COVID-19 responses and humanitarian responses in the country looks like is dominantly then left to the UN and international partners. The other challenging bit that is also available at the moment is that the local NGOs are taking a longer time to bounce back to the realities of COVID-19 in contextualizing it to their operations. And this is majorly due to, either lack of funding, or they even lack the reserve funds, or if they have funding, then there's lack of flexibility of how that fund can be used to concurrently, respond to the COVID pandemic and also be able to respond to the humanitarian crisis in terms of operation. Also, we are looking at currently the COVID posing a big risk to local partners in terms of health safety, which is to their staffs And compared to our counterparts who have, either reserve or flexible funding where they're able to access PPE kits easily compared to local actors. So that is also another hindrance that we are foreseeing at the moment and experiencing in the ground. But then I think COVID also to some degree is bringing forward some positive elements into the game. We're seeing that previously, currently with the issues of restrictions, both globally, one, the international counterparts do not have easy access because of the travel restrictions across the globe. So basically, it leaves then the local actors at the forefront of operations in an already dire, humanitarian crisis hit country. So I think that becomes another strength that COVID is bringing out to the to the game, and we are now acknowledging and beginning to value the fact that national partners can fill in this gap given the current restrictions. The other thing is that the issues of COVID-19 globally being managed by governments. So when we look at our counterparts compared to the local actors, is that the local actors have easier access to their communities and to their governments compared to the international actors or the United Nations, which give us a better position to be able to now shape the conversations on how we need aid to be delivered, on how we need the COVID pandemic response to look like, because we easily can relate with our own governments, which is not likely for the international organizations. The other thing also is that with the issues around, previously, traditionally, there's been a lot of limitations in terms of access to international partners, and this has been more emphasized with the current ongoing restrictions even in the country. So, which means that the issues around program development, previously program development was just done from an international organization's HQ level, and then the design is just all conducted there without inputs from local actors, and everything was just followed according to what was designed at HQ levels. But I think COVID is also opening up the opportunities for the international actors to be able to now incorporate local decisions, local adaptable designs into their new programming, because we have to start learning on how to live with the pandemic amongst us and continue delivering services even beyond COVID-19. The last thing is that we now also emphasize to donors, to start looking at their strategies, at their policies, and try and loosen some of these conditions, because if the pandemic keeps at this rate, then that means that issues of funding through international actors will have to be, that approach has got to change at some level, and we look at direct funding from donors to local actors in order for operations within the humanitarian sector not to come to a stop. But finally, also COVID is giving us an opportunity to look at it from an angle of mainstreaming issues of gender, because with the COVID, there's been a lot of gender-based violence to women, children, but also as we're looking into these kinds of injustices practiced on women and young girls, we also need to start making it gives us an opportunity to start looking at a positive, to look at research around also the health element of it, because much as we're experiencing gender-based violence, yes, it's something that we need to look at, and then within our work mainstream how we do that, how we go about it during these times of pandemic. But also it gives us an opportunity to be able to start looking at our statistics in especially the middle and low income countries. We're seeing that a lot of males are being affected more due to COVID-19 compared to the women. And then we could begin critically asking ourselves, why is that statistic so? And in the case of South Sudan, when you look at it, is that more men are affected than women, more men are having higher mortality rates than women, and that could be maybe a discussion I could, ignite on this forum, and people could look at that from a gender lens. Over, Peter.
Thank you, Gloria. Thank you, Gloria. All in all, I would say it's more, of course, the pandemic is never negative, but for the position of local NGOs, it might be more positive than negative. The negative items you mentioned were you were partly weakened in decision making because of technical issues, health risks, and lack of funding, or lack of flexibility. But the good things were international partners don't have access. Local NGOs have better contacts with the local decision makers about how should the aid be delivered. More ear from international NGOs towards the local NGOs in program development. All good things, I think. And beautiful, you mentioned also those gender issues. Hero is having trouble with getting the connection back. She's working very hard, but she just sent me a text message. Please go to the second speaker, Feliciano, that's you, all the way from Venezuela. It's very early in the morning with you. Can you take over, Feliciano? How does COVID impact on your position as a local leader?
Thank you very much, Peter. And yes, good morning. It's not so early in Venezuela, but and good afternoon to all who are in another part of the world. I think I should take some of the points made by Thea. I think they are really important, and we have been dealing with them from the very beginning. And saying here, Peter, that coming from at least 4 years of a context of a complex humanitarian emergency, now having all the on COVID-19 and treating the situation as a health or public health crisis, runs the risk of making invisible what we had been facing before, and how Venezuelan civil society, and together with some partners abroad, had been preparing for, facing all the challenges, again, of providing aid services, and as well in trying to keep the space open for civil society. We had already been facing risks in our work, restrictive legislation, which now, adds to states of alarm that continue to be, put on month after month, which is again affecting the work of humanitarian organizations, of human rights organizations, and civil society in general, I should say. We are coming from a situation of precariousness, which again had forced even many organizations to move into the realm of humanitarian work, even though it wasn't, our main issue, let's say, including our own Acción Solidaria, which, now with almost 25 years of work in the area of HIV and AIDS, but we saw the effects of the collapse of the health system already. Starting in 2016, we saw the difficulties of people in trying to get food. So hunger was spreading more and more in the country. And so I think, once again, that it's important to stress, to focus on whatever is happening before COVID-19, before the pandemic. Also, Thea mentioned other conditions. Malaria here has been one huge issue, with over 400,000 people with malaria, particularly indigenous populations in the southern part of the country. So, and water shortages and electricity and power shortages. And now we added recently, and this is again before having to face larger numbers of people affected by COVID, with a lack of gasoline. If you want to get gasoline nowadays in Venezuela, you would have to be in line from anywhere from 18 to 24 hours, and just let your car stand there, you know, and even if it is a public transportation vehicle, even if you're talking about at times ambulances. So there are many other issues around, you know, the direness of the situation for the people in general that have to be taken into account. So part of what we have been doing as organizations and facing all of these, again, this context, again, before COVID-19, has been to, you know, more and more try to get a capacity built to mobilize aid. Many of us have started, and this is again from at least 2016, 17, partnership with international organizations that can supply, say, food or medicines or medical supplies and other basic needs that have been lacking for quite a while. Elderly, the diapers for the elderly, for example. So these partnerships, I mean, this capacity building inside, partnerships in Venezuela, and then also relating to organizations, international organizations, has been, I think, something really important that was in place, again, before coming to COVID-19. Another thing that had been happening was data collection, was having public information to really, once again, inform the work of both national and international organizations and as well the UN system coming in and other actors. And we have, because of the closure of the civic space, because of the restrictive policies, because of let's say the exercise of power based on control, then we do not really have access to public information. For example, health statistics have been held by the health department since 2015. So another thing that we have been doing, again, thinking that it is necessary, is to join in collecting information. So now over 300 groups are sending into, say, our databases information on water, on health, on education, on food access, in order, again, to be able to expose what is happening in the country. And this is even at some points, kind of contradicting the UN system here. The humanitarian architecture was established in early 2019, but we have felt that, unfortunately, at times the humanitarian architecture sort of and the publication of data takes into consideration government sensibilities. And we think that this is a huge mistake, and this causes a lot of trouble. One thing that we did, and this is in terms of advocacy that was important, was to at least get this very important assessment done by World Food Program with organizations on the ground last year on food insecurity. And once again, before COVID-19, 32% of the Venezuelan population is acutely food insecure. And by September of last year, they had already said that 17 million more, so this would bring the total to about 90% of the Venezuelan population. So 17 million more were at risk of becoming food insecure if there were any extra adverse effects, and they're here now. I would close with some of the things that Tia also said in terms of taking decisions from the top and not considering, what is happening on the ground. We again see this even in the language that is being used. And coming from HIV and AIDS, I think that is a huge mistake of even the scientists and the medical community. It's like if you're not respecting confinement, you're irresponsible. That's incredible lack of empathy with, you know, the lives of people who have to come out every single day to get food. How do you, you know, stay at home in a quarantine even for 5 days if you are living on a daily basis? So, you know, language is one thing that is really important because it resonates with the people. It can lead to stigmatization and then to discrimination as well, to fear, and it's something that has to be dealt with. So the way in which this has to be conveyed in terms of messaging, of working with people in order to prevent the extra effects that COVID-19 poses on the population have to be worked together. They cannot be just thought of, you know, from the top and then imposed again. What you said about schools, about you know, these responses, Thea, with any consultation really is creating already huge trouble. We had been in a supposed, let's say, quarantine states with many implications on people in terms of repression since the 13th of March, but it is now in June when we're starting to see the numbers goes up. So are we going to go into further 2 months, 3 months of closure? This is an enormous impact on a population that is already suffering from the effects of the complex humanitarian emergency. So our work on advocacy, visibility, again, demands on the change in the way in which the situation is being dealt with, from, you know, increasing our capacity, our togetherness, our empathy with the population has been one of the things that we think has made at least, you know, certain changes in the way in which the actual situation is being dealt with. Thank you very much, Peter.
Thank you, Feliciano. Describing a situation that was already very grim, but became much, much more grimmer due to COVID-19, like 42% food insecure went up to 90% insecure. You recognize the picture Thea sketched on the top-down approach, which appears sometimes with a lack of empathy, a lack of knowledge, and which might be even dangerous. And one question for you, Feliciano, before we move on. Gloria also described some positive effects, like getting local NGOs more into position, a better position towards local authorities, a better position towards international NGOs. Do you recognize this, or is that not applicable for your position?
I would say yes. So what Gloria mentioned, I think it's important, and particularly, I mean, to us, it's that access to communities and the possibilities of delivering aid. We have had the international, say, community, humanitarian community, and UN system, and other partners on the ground. And what we saw was some leaving actually Venezuela right before the closure of the mobilization space. So yes, I'd say that this has imposed, you know, more pressures, more demands on us, on our staff, the way to think much more creatively, to continue to be able to work on the ground. And yes, maybe these are issues that we find positive in the work of local NGOs. But I think it is important to note that we are in a very restrictive political context. So even with the you know, absolute commitment to continue to work and to again build back or bounce back, as Gloria mentioned, it has been challenging. But it's true, Gloria, that we realizing these obstacles and these difficulties. I think it has obliged us to work more and more together, you know, and to build from our local capacities, absolutely, and to stand up and demand more of an acknowledgement and recognition from the international community. Yes.
Thank you so much, Feliciano. We had lost Hero for a while, but she's back. I'm glad to have you back, Hero. You're loud and clear, I hope. We just finished the introduction of Feliciano. Could you take over and describe the position of you in Iraq?
Thank you, and I'm sorry for that. I wanted to have a better internet, but at that time, something was wrong with my laptop, and then it just got stuck. I apologize.
No problem.
Yeah, and I'm sorry that I missed the talk of the other two colleagues. I will try to watch the video later, the recording. I work for a national organization called REACH, Rehabilitation, Education, and Community Health. We are in Iraq. There's sometimes one government is too much, but we have two governments for the one we live in Kurdistan, Iraq. The Kurdish regional government and the central government, which means for the areas that are administrated by the Kurdish government, we have two governments, and then the other area is one government, like that, the one that is outside Kurdistan. That make the work of local NGO more challenging, because we need to spend huge amount of time on the coordination and getting access. Like, before the curfew, before the COVID-19 challenge, we had a lot of challenge and problems with access letters. The areas that was taken by ISIS, later their name was changed to ISIL, then they were taken back by the Iraqi government and the so-called coalition forces. These areas, okay, during the beginning of the fighting, it made some sense to ask for access letters. But when it was completely taken back or returned back to the Iraqi government coalition forces, I don't know what's the point for getting access letter by NGOs all the time. Sometimes, like, depending on the time, we got one or two, access letter for 1 week or 2 weeks or 1 month. Like the 1 month is not very familiar, not very common. So since November last year, the Iraqi government stopped access letters for NGOs. What that mean? It means these areas that were suffering most in Iraq, NGOs had could work very little because of the problem of access letters. And in COVID-19, that make it even another layer for the work, because the curfew is added. I understand curfew is to protect people, and there was a little bit of flexibility, but not enough, not good enough for the NGOs to be able to do our work. So on one hand, the government both of the governments, oh, we don't have enough capacity to help the people in need, but on the other hand, they don't support us to do our work. So that's a real problem. And so the curfew in the beginning, and up to now, there is up and down the curfew, for it stopped and then it starts again. Plus the psychological impact, people are concerned about their families, their everything, and about income. And in Iraq, the income, most of the income comes from oil. And because of the price of oil, went down, that's a real challenge. So before that, people were concerned about the budget of Iraq for this year. But since the COVID-19, it impacted for oil price to be less, which make it another big problem for people in the time that people lost their jobs because of Corona. So that make the work of NGOs even more difficult, because we see these people the number of vulnerable people increased significantly, while our ability to work is decreased because of the movement as access and because of the fund is decreasing. In Iraq, because of people got tired to get funds to donate to Iraq, the donors, the individuals. And then with this COVID-19, the concern is by the NGOs is the funds will be less and less in general, and especially for local and national NGOs. And when the fund gets less, the NGOs implement more by themselves and they don't give it to us. And up to now, the amount of fund that's given to the local and national NGOs, we are not happy with the amount. We need to do more. But imagine that will be much less. And unfortunately, this industry is become a business. I'm sorry, not by everybody, but by the majority, unfortunately. So it's a business. They want to keep all the offices, like the INGOs, the UN agencies. They want to keep their staff, their offices, and that means they cannot give us, share the fund with us to be able to do the work, while we need the presence of the INGOs and UN agencies, but we can do most of the work by ourselves. Yeah, for the relation between INGOs and local organizations, it depends which INGO we are talking about. With the INGOs, they believe in localization, they're champion in localization. They have been more caring than the past and try to check on us, how we are doing, and try to be available to help us even more than the past, and just be open with us, and yeah, just very helpful. But for the ones that they don't believe, they are getting even worse. They don't listen, like they didn't listen enough in the past, but since the COVID-19, they just ignore the thing. You know, they just put it on us, and that's make it more difficult. Like one example, we had a project started, and then for some reason, the funding partner didn't send the fund in time. Finding some excuses, I don't know. And we were in a very embarrassing situation before the lockdown. It was cash for work, so the workers did their work, and they asked for money. This is their right. But then when the lockdown started, it became worse because the banks were closed as well. And then we told the GIZ, and I don't hide their name. We called them, and they said, well, we cannot do anything. Okay, if it's a real thing for them, they care. It reached a level that the workers said, we'll come to your office and we demonstrate. It's our right. But GIZ didn't care because they didn't get that message. And I don't complain, but my colleagues understand the ego of these funding partners, and they didn't do my suggestion. I said, let's send them to GIZ office. You know, it's them, it's not us. But because of that imbalance in power, they said, no, 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 we need to keep this relation. It's too much, you are very tough, okay. So we ended up suffering from that and being embarrassed for something that it was not our fault, and it was the fault of GIZ. But I wish it was only them. Most of them are like that. The majority don't believe in localization, even if they sign Charter for Change or sign ground bargain. The minority practice it on the ground, unfortunately. Sorry, I talked too much.
Thank you, Hero. Thank you. Also a grim picture. The ability to do your work is diminished because of the government, who doesn't allow you to do your work, but also because funding isn't going as much to local NGOs as to international NGOs. And the work has become bigger because the economic consequences of the COVID crisis, the oil prices going down, that's also a grim picture. And international partners not taking localization seriously, actually what you're saying. Anita, I would like to go to you. I have basically two questions. The one is perhaps you can give us an update on what is happening in the chat box, but if that's possible, otherwise I can summarize, and there are maybe some questions also. And the other thing is you work as a policy officer on localization. What do these stories tell you? What is this? What is the message you found important? Please, Anita, can you share it? Can you share your reflections with us?
Yeah, thank you. I mean, what I appreciate about the Harold, Gloria, and Feliciano's different messages is contextually, the humanitarian architecture in each of these countries is very different, all established at different times. And therefore, the power structures, the funding dynamics, the relationship between actors, it's all significantly different. And so that becomes the starting point for what is important to take forward and how to move these conversations forward. You know, Mr. Reina, in Feliciano's case, Venezuelan civil society have been working for a long time independently with their communities, and in a context where there's very diminished trust in central government, and this has meant that you know, the role of internationals, agencies has really been in partnership to local and national organizations in supporting them to do the work in delivering services. And this is a very different power and structural dynamic than, say, in South Sudan, where and what Gloria was discussing, you know, where there's you know, more than, you know, decades long of humanitarian system and international agencies operating. And in the same case, very different than in Iraq, where you have multiple governments, multiple systems of bureaucracy, a different history of civil society playing a humanitarian role, and so sorry. Now I might be going on a bit too much, but so because these systems are so different, to me that it says a few things. One, that localization and these discussions of localization really need to be embedded in a country context. As Hera was saying, if we are not able to feel the shifts in the discussion at the country level, then we are not going to make progress. And so there, while it's very good that we have conversations like this, which allow us to make links and learn from each other, really these conversations need, this kind of conversation needs to be very embedded at the country level. And that's probably the first point and the most important. The second point, or what I learn, is that you know, there are some common things or drivers or needs of local and national organizations at in countries where which I can contribute to. And Oxfam can contribute to at the above country level, and a lot of that comes down to a few areas: policies and practices within our own organization, on how we act as a good partner to local and national organizations like Titi Foundation and REACH and Action Solidaria, but also funding. You know, and what is our, as an INGO, what is our role as a intermediary for donor funding, and what is our role as an advocacy organization to push donors to provide direct funding, as Gloria has asked. So, you know, because so much of so many decisions are made around funding at the above country level, I think it's important there that you know, that we as international actors play a role in working around funding flexibility, things like this. I'll leave it there for now. But yeah, thank you all actually for sharing your experiences. It's all very complex contexts.
Thank you, Anita. We are already 50 minutes going, so I think we might be even going slowly towards an end. What I will do is give each speaker at least one chance to reflect to the other speakers and to give some final comments. And there is one question. It was the first question that was raised, and I think that might be a very handsome one to maybe, if anybody has a good suggestion, please say so. The other questions are rather deep going. What I would suggest is that we share the questions with all the panelists, ask you to take a look into it Monday or Tuesday and come back with your feedback, and we can publish it on our website. So everybody, all the questions we can address in a decent way in this way. And I think the panelists will be able to respond to those questions. The first question was, because it was about money, and money is of course very important, how to raise funds as a local organizations at this challenging time. I think it's for everybody very difficult. If anybody of you has a good suggestion how to find money as a local NGO in these complex COVID times, please share it with us. And the other question is, any remarks you have for the other speakers, do so. My main question for everybody is, as a final round, it was Churchill, I think. He said, never waste a good crisis. When it's up to you, what is the opportunity we should not waste at this time? Because the world is changing. And that means things go to the worse, but some things can also go for the better. So what is the opportunity we should not waste now? With whom shall we start, Anita? What do you think? You don't know?
Start with Hero, and then
okay,
and
now we start with Hero. Then we
yeah,
go the other way around.
opposite.
Okay, Hero, the floor is yours.
Yeah, would you mind to repeat the question that you just, the last two sentences that you said? Sorry.
The last one is, COVID is also an opportunity. What is the opportunity we should grasp together? What should we not lose at this moment?
Okay.
It's a difficult one. I know, I'm sorry.
Yeah. Well, it's a reminder, I think, in general about, like, that's for all, I mean, individual and NGOs, to appreciate the little things that we have. And we take it for granted, but we don't see it, we don't appreciate it. So I think for me, that's really important. And the power of community and togetherness. When we had everything before Corona, we forgot that. We forgot that community and people are important. I mean, most of us, but this crisis reminded us we need to appreciate that and invest in that, because we think that we are busy, we don't have time for people, we don't have time for community, we don't have time for our families. But we are wrong. It's just setting or reordering the priorities in the better way. At the level of, like, specifically about NGOs, there's a, you read the question, and I saw it, like, how to fundraise. This is one of our challenges, and even it's one of the weaknesses of us in Iraq as local and national NGOs, that we completely rely or depend on the funds we get from others. We don't fundraise, we cannot do fundraising ourselves. Before that, we said we cannot do it, it's difficult, and we don't know how to do it. But I think Corona told us, be creative, be crazy, just try new things and shout and ask, and just don't stop. Don't just wait to beg. Sorry, I don't mean it in a bad way, but like, we are begging. I mean, some of the fund that we get, to be honest, I'm the person, for, I don't know to say for my bad luck or good luck, I'm a person who do most of the negotiation for funds for my organization. And it's okay to be a good guy, that's not problem. But it makes me to feel that I'm begging, not with everybody, but with the ones that they're very stingy and they say nonsense. They ask me nonsense question, but if I answer something that they deserve, I'm a bad guy and I've disturbed the relationship with that donor or funding partner. So these things, because we are obliged, like, we are in a situation, we feel that, okay, we have a number of people, some communities that they are waiting for us, let's do the sacrifice. But to be honest, I hope it's not too tough. In my feeling, it's sometimes it's a kind of slavery, accepting slavery to get funds, and it doesn't worth it. So it's better to be, like, you know, to use things that's new, even if it doesn't make, like, it looks like it doesn't make sense, it looks like we are not successful, but start to do something about fundraising and ask everybody who are willing to help us in that process, so that we can raise, I don't mean the whole fund for local organization to come from people from Iraq, but part of the fund, so that we will be in a better position, stronger, and not to beg and not to be a slave of some organization to get funds, because it doesn't worth it. It's just too much. Trust me, it affects us psychologically, mentally. It doesn't worth it. I mean, sorry, but this is how I see it.
Don't say sorry, Harry. Thank you very much. Be creative, be crazy, just don't stop, and don't be a slave. You're quite right, Hero. I want to check with Thea before I go to Feliciano, because Thea, you have to go to class in 5 minutes, I think. Is that true? Can you stay with us another 10 minutes? Or?
No, I'm very sorry. I have to teach. You're right. So this was such an amazing, enriching experience. Thank you so much. I hope that the recording of the session will be available. I like to share it with all my students, and very important that we can hear your voices. Thank you so much. and all my best.
Okay.
I love the notion, let her be a slave, and keep flossing your mental capacities, folks. Mental floss, very good. 3 times a day. Bye-bye.
Thank you, Thea. See ya. Okay, thank you, Thea. We move on to Feliciano. Please take the floor, Feliciano.
Thank you very much, Peter and Hero. I think it's so true, you know, to raise our voices here and to demand our and reclaim our space. I would say, I think it's in terms of opportunity, if one can call it that way, Peter. What we have seen here, it's because again of restrictions, governmental restrictions, and given that international NGOs have not been allowed to register in Venezuela, and that complicates things to work, then it somehow has forced many who would have implemented on their own to find partners on the ground. And it has been great. I think they have been, it's what I hear, it hasn't been our case, but what I hear is that they've been, you know, very well surprised, let's say, which is weird at the same time, of the capacities and the commitment and the possibilities that there are in working with local organizations. I think that it's hugely important to, you know, again, to look at people from the country working on, again, delivering aid on human rights, and to be you know, to receive resources that they deserve, that staff deserves. You know, we really, and Hero was saying it as well, we see at times how, you know, funding comes in, and the first thing is to have a large bureaucracy by international, by UN, I would say, not I wouldn't say here so much international organizations. And one thinks, you know, of the very minimum salaries that staff at times gets, and how difficult it is to, you know, to get proper allocation for, again, people who are hugely committed, and not only so, but suffering themselves the consequences of the situation, living where there is no water, where there is no electricity, where, again, you know, there it's difficult to get along. So I think that's again, if one looks at it as an opportunity, it may be we have been able to get some to understand that, to provide incentives for staff. And it's amazing how in spite of the conditions, there is such, again, you know, regained at least possibility to keep on contributing. In terms of more of the international funding, when one looks at the humanitarian response plan here, again, you see a few hundred, I mean, some hundred and so many projects proposed by civil society, Venezuelan civil society. But once you look at how the requirements are being met, then it's like 0% to local organizations. So there must be another way. When you have the country-based pool funds, you know, it's $10 million or something like that. Again, well, it's great, a great achievement, 35% for local organizations, give me a break. You know, so I think that there must be, this is an opportunity, as you're saying, perhaps, to sort of revise what is happening, again, with funding, with the relationship with local organizations, with staff, with local staff, again, who are in the very front lines of delivering aid and meeting with communities and facing the difficulties of tough ground. Thank you, Peter.
Thank you, Feliciano. And you're quite right. The dark sides of COVID are, of course, much bigger at this moment than the opportunities we might see. But revising what is happening with the funding, we should really take a serious look at it. You're quite right, Feliciano. Thank you very much. And Gloria, are you still with us for some final remarks and reflections?
Yes, Peter, I am.
Please go in. The floor is yours.
Thank you. On the issue, there was a question you posed from, I think, the members on the issue of funding and how they can access that. I think with the so much commitments international partners have put forward in the Grand Brigade, I think it's high time that, you know, we begin to actionalize those commitments into realities by either working hand in hand with local organizations, assisting them in terms of advocacy to the, to the donors themselves, and having these partnerships together with them, closely building, or I would say, increasing on their level of capacity so that they're able to deliver, they're able to, have the capacity to hold the huge funds from the donors. And, basically, so that also they begin to build, the donors begin to build some level of trust towards the local partners. That is one thing that I would clearly emphasize. And I think we're seeing that greatly from colleagues from Chapter for Change, who are signatories, who are slowly, walking the talk. But as a final remark, also, we have seen that COVID has brought people together to a very high degree. A lot of global fundraising in the names of COVID is happening. Yes, it is good, but I think it's high time that, we looked at issues critically, in that with COVID, the intensity of damage is greater compared to previous diseases like Ebola, HIV, or cholera, which are common in South Sudan. But I think there's need for quick, fast fund to be delivered to local actors to be able to reach out to communities. And this is also acting as a wake-up call to donors because of the scenarios and changes in, operations. I think it brings out a call that it is time to really bring and support and value the actions that local partners bring on board. New ideas are emerging to, to change the phase of how things were previously done in terms of response. So with all these innovative ideas coming on board, I think it's time that we value the small contributions, which to me is not really small as such, but great contributions that the local actors are playing, and at the same time for the donors to wake up and really start walking the talk on the commitments that they, that they promised in the grand bargain. Thank you so much.
Thank you, Gloria. Thank you. Donors should walk the talk, and it's time for a really fast fund, international fund to fund local actors. Anita, I think, can you wrap it up somehow? It is a very rich afternoon. Many good reflections and thoughts and messages we received. What is it you're going to bring into Oxfam International with you from this meeting?
Well, further energized to do my work, to keep going, to keep pushing, which is part of my job, to continue mobilizing and organizing our NGO community towards localization, advocacy for localization and progress towards localization. I think the calls to action that we've just heard, from kind of reforming the funding architecture, the humanitarian financing, this is really pretty central. And I think that it has, it has long been on the agenda of the humanitarian system. It is why the Grand Bargain in part was born, and I think that this is really essential if we are going to meet localization commitments. Similarly, this looking again at our partnerships and the quality of our partnerships that make up, in fact, the whole of how stakeholders relate to each other. These relationships, really, let's call them that, these relationships need to be different, and they lack the kind of principled approach which again was committed to long ago by international actors, and so that there does need to be some kind of follow through on this commitment, and the calls to action that Gloria and Hero and Feliciano have all raised within this opportunity, this the context that COVID-19 has, you know, unfortunately or fortunately offered, despite the kind of, you know, suffering and complexity of the crisis itself. I hope that we can deliver on this, and certainly that's something that Oxfam will keep going on.
Okay, thank you, Anita. I think COVID will be a game changer, and let's make sure together that it changes into the right direction. And there are several questions were related to these partnerships, those new partnerships perhaps due to COVID, remote partnerships. I will share the questions with the speakers, and I hope you will find some time beginning next week to share your comments on those questions so we can give them back to the audience of this afternoon and share them via the website. Anita, thank you very much for co-hosting and for helping us getting these beautiful speakers today with us in the COVID Café. Thank you, Hero Anwar. Thank you, Gloria Modong. Thank you, Feliciano Reina Guantome. Sorry, almost good. Thank you,
Feliciano's enough.
Okay, I'm sorry, Feliciano. Thank you all. Enjoy your Friday and your weekend. Next week, we have another COVID Café. It will be on migration, the effect of COVID on migration. Have a nice weekend and hope to see you soon again. Bye-bye.
Thank you.
Thank you, Anita,
Thank you.
Peter.
Bye.
Hero.